Order, please. We'll now move on to oral questions put by members to ministers. The House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. My question through you is to the Minister of Health. A physician who cares deeply about the elderly in Cape Breton put forward a proposal that would see the medical needs of patients in nursing homes met faster while saving money. The Care by Design program envisioned a doctor on call at a long-term care facility for a week so the elderly in nursing homes in Sydney wouldn't be forced to go to the ER for minor issues. The doctors in nursing homes were on board. Funding for the program was found locally. It was taken to the Zone Medical Advisory Committee, and I'll table the document on that, and they signed off on it unanimously. But when it went to the Nova Scotia Health Authority, Mr. Speaker, Lynn Harrigan said no. Despite being a local solution with buy-in from the community, it was axed by a bureaucrat in Halifax. My question to the Minister, how is it that a VP in Halifax has more foresight and knowledge than doctors and Zone Medical Advisory Committee? And why aren't local solutions being heard and implemented?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Whether that was running into conflict with one of the areas where we have seen considerable change in the past couple of years, and that is permitting paramedics to go into nursing homes and work with a patient who may need to be stabilized and can actually sign off and have the patient remain there, which again is avoiding trips to the ER. We're seeing this protocol now develop across the province.
The Honourable House Leader for the Official Opposition on his final supplementary.
Thank you very much, Mr. Speaker. It's a strange decision by the Nova Scotia Health Authority because Care by Design was implemented in the former Capital Health District in 2010. And later in the Colchester East Hants area. The Care by Design model is currently used to provide care for 40% of the province's nursing home patients. Transfers from nursing homes to ERs were reduced by 46% here in Halifax, and in Truro it was reduced by 60%, Mr. Speaker. Yet for some unknown reason, in Cape Breton, they weren't allowed to benefit from the program. So my question to the Minister, why was a sound program like that why is it working in Halifax? Why is it being rejected in Cape Breton? And why aren't local solutions being heard and implemented?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I will look into the actual case that the member has brought forward here today. But one of the developments in our province is that we want all of our healthcare providers to be able to work to the full scope of practice. We have our paramedics going into nursing homes on a regular basis, providing care right there on site and avoiding trips to the ER. They're able to provide medications and other care that they may need. That's a good day for our province, Mr. Speaker, when we can have paramedics doing their job.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, it's difficult to understand the Premier's argument that the best way to address income inequality is through basic personal tax exemptions. If the basic exemption was raised, those currently earning less than the basic exemption would receive no benefit. Further, it would only have a marginal effect on those in the lowest bracket, while those in the highest bracket would benefit much more. So I asked the Premier, can he explain how raising the personal tax exemption will help address income inequality in Nova Scotia?
The Honourable Premier.
I want to thank the Honourable Member for the question. If she had actually listened to the answer that I gave, Mr. Speaker, what I said is I believe the basic personal exemption should be on a sliding scale. I don't believe anyone in this House should have their basic personal exemption raised, Mr. Speaker. I think it should stay where it is, but there are those low-income Nova Scotians that we should, Mr. Speaker, support by increasing their basic personal exemption. We're looking at that to make sure that those who need our support will get it, Mr. Speaker. So with every decision that this government makes is how it's impacting the Nova Scotians, and we're going to continue to be focused, Mr. Speaker, in moving this province forward.
The Honourable Leader of the NDP Party.
Mr. Speaker, the Premier has one talking point on income inequality, and I don't think economists or Nova Scotians are buying it. Raising the basic personal tax exemption will not address the growing gap between rich and poor in this province, where the top 1% makes 10.5 times more than the bottom 90%. Mr. Speaker, we know raising the basic exemption is not the answer to this issue. So I ask the Premier, what other solutions does the government have for addressing income inequality?
The Honourable Premier.
Thank you, Mr. Speaker. I want to again tell the Honourable Member leaving more money in the pockets of Nova Scotians, low-income Nova Scotians through the basic personal exemption leaves more buying power for them, Mr. Speaker, would not be eaten up in inflation over the next number of years under their program. Quite frankly, Mr. Speaker, we're going to continue. We've had the largest single increase in income assistance in any government in our history, Mr. Speaker, in this particular budget. Mr. Speaker, we've invested to graduate to opportunities, which is providing people from an educational institution into a career and a job opportunity, Mr. Speaker, providing every Nova Scotian a chance to get their first start here at home. Mr. Speaker, we've announced in this budget an investment in public education to continue to make sure that every young Nova Scotian gets the right start they deserve instead of cutting $65 million out of education like that government did. We've invested in, Mr. Speaker. We've targeted towards literacy and numeracy, Mr. Speaker. We've announced in this budget work towards increasing for child care, Mr. Speaker, making sure that the men and women who look after our children are being remunerated properly, Mr. Speaker. We're going to continue to invest, Mr. Speaker, to ensure that every Nova Scotian sees themselves in the institution of government.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, this government just doesn't seem to get it. For 2.5 years, the government has pursued policies that have exacerbated income inequality in Nova Scotia. They've made cuts to organizations and not-for-profits that help to bridge the gap between the rich and the poor. This government has frozen social assistance rates for 2 years, and when they finally raised it by $20, they think they should be thanked for that and moved on to congratulate themselves for it. Low point in this sitting, I might add. So I ask the Premier, why is this government compounding the problem of income inequality in Nova Scotia?
The Honourable Premier.
Mr. Speaker, I completely disagree with the premise of her question. We continue to work with our partners across this province to deal with the many challenges that have been faced in this province for generations, quite frankly, that were ignored by the previous government. At no time, Mr. Speaker, at no time will this government need to take a lesson from a party that sat and was paralyzed by the opportunity to govern this province and continue to follow our province further and further behind, Mr. Speaker. One-time experiment with that party, Mr. Speaker. Nova Scotia gave them the...
The Honourable Premier has the floor.
Mr. Speaker, I want to thank the honourable member across who keeps yelling across, recognizing, Mr. Speaker, that Nova Scotians are understanding that we are a government focused on the people of this province, Mr. Speaker, ensuring that we're fair to every Nova Scotian, Mr. Speaker.
The Honourable Leader of the Official Opposition with 2 supplementaries.
Thank you, Mr. Speaker. This government is restricting the ability of new doctors to practice at walk-in clinics. Mr. Speaker, their policy is very clear. It reads, and I quote, "Requests for new physicians to work in walk-in clinics will most likely be denied." Well, Mr. Speaker, those walk-in clinics provide a very important service, particularly to Nova Scotia families that do not have a family doctor. This is a bad policy. It is a bad decision that will hurt people that need access to doctors. I'd like to ask the Premier, will he reverse the ban on new doctors practicing at walk-in clinics?
The Honourable Premier.
Mr. Speaker, like oftentimes in this House, Mr. Speaker, the honourable member is simply wrong.
The Honourable Leader of the Official Opposition.
Mr. Speaker, what is wrong is a Premier that does not see 90,000 people without a doctor, promising them that they'd all have one, Mr. Speaker, and then making things worse because when they go to a walk-in clinic because they don't have a doctor, he tells them that no new doctors are allowed to go there either, Mr. Speaker. That's what it's wrong. It's not wrong here in the floor of this House. It's wrong out there where people need help, Mr. Speaker, and they're being told no by this Premier. Mr. Speaker, 90,000 people, no doctor. They go to walk-in clinics. Even the health authority spokesperson said walk-in clinics are important for people that don't need a doctor. So he won't restrict the ban. Will he explain to this House why he is restricting access to doctors at walk-in clinics when the need is so great?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. In his preamble, Mr. Speaker, he identified that 90% of Nova Scotians, 900,000 Nova Scotians, have access to a family physician, Mr. Speaker. That's That's above the national average of any province, Mr. Speaker. We're going to continue, Mr. Speaker. We're going to continue, Mr. Worker. We're going to continue to work, Mr. Speaker, with our partners, the Health Authority.
Order, please. The Honourable Premier has the floor.
Mr. Speaker, we have 31 physicians that came in the province. There's 14 more ready to go, Mr. Speaker. We're going to continue to work with our partners across the province. And at no time, Mr. Speaker, did we say that there wouldn't be able to be walk-in clinics, Mr. Speaker. We're going to continue to provide those services. Mr. Speaker, the honourable members can still shout across if they like, but the reality of it is, Mr. Speaker, we're achieving outcomes for Nova Scotians, Mr. Speaker. We're on our way to ensure that every Nova Scotian has access to a family physician, Mr. Speaker, and the numbers speak for themselves.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, we will come to this House and shout every day until that Premier keeps his promise that every single Nova Scotian would have a family doctor. He may be satisfied that 90,000 go without, that 10% go without, but we're not satisfied, Mr. Speaker. It was his promise to ensure that every Nova Scotian had a family doctor. They're making things worse, Mr. Speaker. So will the Premier explain to this House how limiting new doctors at walk-in clinics helps make his promise kept?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. Again, the entire premise of his question is wrong, Mr. Speaker. Again, I want to tell the honourable member we have 31 new doctors came this year. We have 14 more to come. And we know of, Mr. Speaker, the Minister of Health is working with our partners, continuing to move forward. Mr. Speaker, we've seen
order, please. Order, please. Order, please. The Honourable Premier has the floor.
Mr. Speaker, the honourable member keeps to audition. He has an opinion about everything in this province. At some point, I hope he stands up and is held accountable for what he thinks about municipal amalgamation, Mr. Speaker. Mr. Speaker, perhaps the honourable member might want to do his job, Mr. Speaker, and stand with the people, municipal leaders in his riding, for transformational change.
Order, please. The Honourable Leader of the New Democratic Party.
Thank you. Mr. Speaker, African Nova Scotians comprise about 2% of the provincial population. However, represent a much greater proportion of those admitted to correctional facilities. 14% of all adults in provincial custody are African Nova Scotians, and 16% of all youth in provincial custody are African Nova Scotians, and I will table those figures. These are numbers that just came into our office, and I have to admit they are very troubling. I would like to direct my question to the Minister of Justice. How can the Minister explain the overrepresentation of African Nova Scotians in our
The Honourable Minister of Justice.
Thank you very much, Mr. Speaker. And I want to thank the member opposite for raising this question, because I think it's a societal issue that we all need to be aware of. And I think by raising it here in the House, it helps to bring our attention to it and to look for answers. The fact is the justice system is the final part of a path that is probably characterized by lack of opportunity, illiteracy, lack of education, or early childhood education. So we're addressing those issues today by investments in education, by making early childhood education more available, by doing other programming in communities such as ceasefire, hub communities, and so on. But I recognize the problem, and I certainly would welcome other answers from the opposition as well as the work that we're undertaking.
The Honourable Leader in the House for the New Democratic Party.
Thank you, Mr. Speaker, and I thank the Minister for her response. At close to 20% of all youth custody in custody in Nova Scotia are African Nova Scotians, despite making up less than 2% of our total population. Mr. Speaker, I do not think anyone would find these numbers acceptable, and all youth in Nova Scotia deserve equal opportunities to succeed. Looking at these numbers shows us that something is clearly wrong. I would ask the Minister if she could detail specific actions her department could take to address this disturbing trend of over-representation of African Nova Scotian youth.
The Honourable Minister of Justice.
Thank you very much, Mr. Speaker. I know that the member opposite would recognize that this is a very complex issue, one that has deep societal background and history, one that, as I mentioned in my first answer, really is the result of so many other factors. And justice is the final part when people come into contact or conflict with the law. That's after many other, I guess, societal issues that need to be addressed before that. What are we doing? We're doing restorative approaches in schools. 150 schools in the province have that in place, teaching young people to resolve conflict, to deal with anger, to deal with their peers and others. I think that has tremendous opportunity for the future, and there are other programs as well I'd be happy to talk to the member about later.
The Honourable Leader of the Official Opposition.
Mr. Speaker, yesterday we learned that neither Bay Ferries nor the government will be releasing passenger counts as the sailing season for the new Yarmouth Ferry goes on. Mr. Speaker, that is unfair to the taxpayers that are footing the bill. They should at least get reports on how the boat is doing, Mr. Speaker. This is a bad deal that the Premier has signed for taxpayers, and it keeps getting worse as the details come out. Mr. Speaker, I would like to ask the Premier, will he commit today to reporting monthly on passenger counts for the Yarmouth Ferry in the upcoming season?
Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. I want to thank the Minister of Transportation for the work he's been doing along with Bay Ferries to ensure that our international link is there. Mr. Speaker, we're looking forward to building on the great tourism season that we had last year, and this festival will be part of that, Mr. Speaker, and businesses across this province will be counting the people on that boat, Mr. Speaker, because they'll see their numbers increasing.
The Honourable Leader of the Official Opposition.
Well, I guess we're all supposed to just go down to Yarmouth and count the cars ourselves, Mr. Speaker. Well, that is not good enough. That is not good enough, Mr. Speaker. This is already, Mr. Speaker, a deal where the company gets a guaranteed profit that the Premier is keeping secret, that the taxpayers pay all the losses. They're rebuilding the terminal in Portland, Maine. They're painting travel lines in the lead up to the terminal in Portland, Maine, Mr. Speaker. They at least deserve to know whether this is a success or not. They deserve to know every month how many passengers are actually coming on the Yarmouth Ferry. Mr. Speaker, it's a simple matter of public accountability. I'd like to ask the Premier how he can possibly justify keeping Nova Scotia taxpayers in the dark about the passenger counts on the Yarmouth Ferry.
The Honourable Premier.
Mr. Speaker, the honourable member knows that is not the case, Mr. Speaker. I'm sure Bay Ferries will be reporting to the province. I know the Minister at some point during this time will give people an update. But there's one thing for certain, Mr. Speaker, not a single Nova Scotian would ever ask the Leader of the Conservative Party to go down and count cars coming off that ferry, because we want our visitors to be optimistic when they come into this province and not pessimistic.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question is for the Minister of Health. To this day, people are forced to leave the province to seek treatment for Lyme disease because the diagnosis is not always readily available here in the province. And according to the CDC, Lyme disease is the #1 vector-borne disease and tick disease, and people are increasingly aware of the risks and are going to greater lengths to protect themselves. But the healthcare system is not keeping pace. Accepted diagnosis is changing. Concerns are being raised about the testing mechanisms used here in the province. So I'd like to ask the Minister today, what is this government doing to make sure that we are using up-to-date diagnosis and testing methods right here in Nova Scotia?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I thank the member opposite for raising the question. It's not a day to go into the long history of how we have improved our professionals on the ground, our MDs now with diagnosis. We know that all across Nova Scotia, anywhere and everywhere, we can have ticks that can spread the Lyme disease. What I now see emerging across not just Canada but the United States, we will have, in fact, one protocol, and it may be just a matter of weeks before that will be made available to all Canadians.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. So I want to make sure that the province is using the most up-to-date diagnosis guidelines, and that the testing that's being done in the labs here is according to the accepted procedures. So I think I just heard the Minister say that he's looking at that. and you'll be able to confirm that within a couple of weeks. Just maybe get a bit of clarification on what steps the minister is taking to make sure that we are using the most up-to-date diagnosis guidelines and what we're doing to review the testing procedures in our labs.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I know Dr. Hatchett was at the national conference held just in the past week, and his lab is currently doing testing. But as soon as the new guidelines are brought forward, Nova Scotia will be certainly in compliance with the best diagnostic protocols that will be, in fact, common across North America.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, in 2015, 39 first responders and 12 military members have committed suicide across the country. And in 5 short months, 18 first responders and 12 military members have committed suicide, Mr. Speaker. Over 2 years ago, this government committed to striking an all-party committee to examine ways to support first responders with PTSD. Since it looks like the government is not going in this direction or going to do this, Mr. Speaker, I'd like to ask the Minister of Labour and Advanced Education, will the minister commit to bringing forward presumptive WCB coverage for first responders in Nova Scotia?
The Honourable Minister of Labour.
I want to thank the honourable member for the question. We do know that folks living with PTSD do have a difficult time, and that is why in 2014 I did ask the Workers' Compensation Board to begin actually tracking the number of first responders who do make claims under WCB. As the member knows, we did meet on this particular issue. I indicated to him at that time that we were going to start tracking those numbers. What we do see, in fact, Mr. Speaker, is that most PTSD claimants are in fact dealt with in a positive way, and I would urge, and we have actually taken some steps, Mr. Speaker, to make sure that people understand what the rules are around PTSD claims for WCB, so that people understand that contrary to what has been out there in the public, that our first responders can receive coverage for multiple incidents, and that, in fact, contrary to what some members have been saying, that the diagnosis does not have to come within the first incident. Thank you.
The Honourable Member for Sackville-Cobequid.
Well, what should concern Nova Scotians, Mr. Speaker, is what the minister just said most. The Minister of Labour will say, and she has indicated, that people are eligible for help within a year of being diagnosed. But quite frankly, Mr. Speaker, that's not the issue. Presumptive legislation means that first responders get the support they need sooner rather than later. BC, Alberta, Manitoba already support first responders in this way. New Brunswick and Ontario are currently in the process of doing the same. Nova Scotia now falls behind the rest of the country. So I continue to be met with delays in addressing this serious issue. So I'd like to ask the Premier, given that provinces across Canada are recognizing the need, Mr. Premier, the need for automatic PTSD coverage for first responders, does the Premier agree that the time has come for Nova Scotia to do the same?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. My commitment to the minister, to the member, former minister, that I will work with my Minister of Labour and Advanced Education to look at this issue both internally and how it's being dealt with nationally. And we'll get back to him, and I'll get back to him with the appropriate response.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. My question through you is to the Minister of Advanced Education. A couple of days ago, we learned that a young man attending Mount St. Vincent University was forbidden from talking openly about his mental health issues because of a confidential wellness agreement. The agreement says that the student will not discuss or engage in conversations with resident students regarding personal issues, namely the student's self-destructive thoughts. This policy does nothing to end the stigma associated with mental illness and may prevent students from coming forward to receive help. Will the minister review the updated language in the Mounts Wellness Agreement to ensure it promotes healthy dialogue and stigma and helps students to get the help they need?
The Honourable Minister of Labour and Advanced Education.
I want to thank the honourable member, and I think we both share a desire to make sure that students feel safe and well supported on campus. I do want to assure her that the Mount is an independent board-governed institution. Nonetheless, we reached out to the Mount to find out more information about that. They have agreed to look at that policy, Mr. Speaker. They understand that the intention of the policy was, in fact, poorly communicated, and I expect to see changes, yes.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker, and I'll thank the Minister for her answers. The penalty for not following the rules set out in the Wellness Agreement is the termination of the student's lease. The student in question said he felt he had no choice but to adhere to the agreement so he could continue to live on campus, and this is very sad, Mr. Speaker. The agreement was absolutely inappropriate, and it totally negates the efforts that we're all trying to help in promoting awareness and to remove the stigma around mental health. So my question is, will the minister ensure that no other universities have these sorts of agreements that promote to silence students with mental health issues?
The Honourable Minister of Labour and Advanced Education.
I want to thank the honourable member for the question, and we understand that the language in question in this particular case is a rarely used provision, and its purpose was in fact to send the student in the right direction for help in times of extreme crisis. So I want to be clear on that for the honourable member, and we're just about to sign our MOU, which does in fact include a portion on methods for student success, including mental health. So I do want to assure her that we are working on that with our universities. Thank you.
The Honourable Member for Kings North.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Transportation. Mr. Speaker, the Canfield Bridge over the Cornwallis River is 85 years old and has had weight restrictions on it now for more than a decade. It's an important bridge in our area and especially well used by emergency services. Last year, the Minister committed to replacing the bridge this year, and I will table that. My question for the Minister is, can the Minister update the House on the progress on the construction plans and the expected completion date of the Canfield Bridge?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and I thank the member for the question. The bridge, the tender for the bridge is basically ready to go. We're just finalizing some details with the municipality on the overall agreement. We certainly expect, without question, that the work will begin this year. We fully anticipate that we'll get it fully completed in this year's construction season. That's the plan. That's the goal. We hope we can stay there. So, barring any major catastrophes or anything that changes the schedule, we should be all clear and done with the new bridge in 2016. Thanks.
The Honourable Member for Kings North.
I'd like to thank the Minister for that answer, and I know that the construction of the bridge will at some point bring the Minister to Kings North, and I would like to ask the Minister if he would commit to travelling with me to look at a couple of other roads in Kings North when he's in Kings North.
The Honourable Minister of Transportation.
If I said no, Mr. Speaker, I'd end up in his newsletter and on the website. So, of course, the answer is yes. I'll see you there. Thanks.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question today is for the Minister of Education and Early Childhood Development. In budget estimates, I asked many questions this session about how investments in early childhood education will be rolled out. And the Minister's response was that her department didn't know what the needs are within the sector and didn't have the data to know what the actual costs would be. This in spite of having just conducted a review which included interviews with key parties and survey which was completed by more than 7,000 Nova Scotians. So my question for the Minister is, could she please explain today how it is possible that even after doing this review, the implementation piece seems to still be missing?
The Honourable Minister of Education.
Thank you, Mr. Speaker, and perhaps we should first correct a statement. I certainly did not say that I did not know the needs of the childcare sector. We spent extensive time consulting, received the recommendations, spoke to those recommendations, and the implementation plan is something that, as I said at that time, will be laid out and will be shared, but we will share that with the stakeholders first. I anticipate that will be next week, but we will not do that without all of the stakeholders having been fully engaged.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Well, during budget estimates, I had the opportunity to take a very good look at the budget of the early childhood development over the past few years, and a few figures jumped out at me. For one thing, there appears to be a transfer of funds, millions in fact, from the Department of Community Services to the Department of Education for the entire early years division. In fact, that appeared to be around $44 million. So my question for the minister is, does the $65 million figure that she continues to say she's putting back into this education department include the amount transferred from the Department of Community Services?
The honourable Minister of Education.
Thank you, Mr. Speaker, and I think we need to talk about what figures jump out, because when you look at the investment that that government made in early years, it declined by $6 million. They gouged that out of early years while they were there, and we, Mr. Speaker, are putting that back.
The honourable member for Sydney River, Myra, Lewisburg.
Thank you, Mr. Speaker. Mr. Speaker, my question through you is to the Minister of Health. Strange, I know.
Order, please. The honourable member for Sydney River, Myra, Lewisburg has the floor.
Thank you, Mr. Speaker. Mr. Speaker, after contributing their whole life, seniors deserve to be treated with compassion and dignity when they can no longer care for themselves. Under this government, seniors waiting for a placement are being forced to accept a spot anywhere in the province. If they don't accept, they are taken off the list. Not put on the bottom of the list, Mr. Speaker, but completely off the list for 3 months. Plus, they are only given 24 hours to decide. They cannot defer. They have to make a decision. So my question to the minister is quite simple. Will the minister change the requirement that a senior must decide to take the first available bed in 24 hours or be removed from that waiting list?
The honourable Minister of Health.
Thank you very much, Mr. Speaker. I am pleased to say that we've made great strides with connecting seniors in hospitals to nursing homes to home care. Many of the people on the list, the 1,000 that we've reduced the list by, many had never even been asked about home care as a first option, and I'm pleased to say that many receive home care while they, if they're off the list, they can get back on the list. And I'm pleased to report to the House and all Nova Scotians that in fact we've had examples of where a person was not ready to go into a nursing home but had some kind of a health trauma 3 or 4 weeks after declining to go in a nursing home, went to hospital and immediately got them in a nursing home.
The honourable member for Sydney River, Myra, Lewisburg.
Thank you, Mr. Speaker. Yeah, it's been a trend of the minister to avoid answering questions. And that's, I know this is called question period, not answer period, but I can't for the life of me understand why he can't just say, yes, he'll look at it, or no, he won't. Mr. Speaker, we've heard a lot of heart-wrenching stories about situations where husbands and wives are separated in different nursing homes. Local doctors tell us that it is not necessary, and if officials would simply have a conversation with the families and residents, people would move to accommodate them. After all, Mr. Speaker, this is Nova Scotia. It doesn't cost anything to ask, but the Health Authority will not do that. Will the minister ensure that compassion and common sense, and I repeat that, common sense, prevail to keep couples who need long-term care are together whenever possible?
The honourable Minister of Health.
Thank you very much, Mr. Speaker, and I'm pleased to say that both points that the member has raised today are being addressed in the next continuing care strategy, which will be out in early 2017. And I'm pleased to say that through intervention, just in this past year, 3 couples who were in different nursing homes were united, even if they were requiring different levels of care. This, I can say to the member and to all Nova Scotians, will become the policy of the future. Couples will not be separated.
The honourable member for Pictou West.
Thank you, Mr. Speaker. My question through you is to the Minister of Health and Wellness. Many of my constituents are without a doctor due to the sad and untimely death of their doctor. These constituents have been contacted this week that in order to get their medical records, they must pay a company in Ontario. And the fees start at $87, and in fact, I had a friend yesterday pay up to $200 to retrieve her files. So my question to the minister is, does he agree or disagree that this process to retrieve personal medical files is fair?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Just in the past 2 weeks, this question was also asked by the member for Sackville-Cobequid. I have asked Dr. Gus Grant to look into this issue. We know that we have, patients who don't have the means to pay that kind of money to retrieve their records. I believe it's an area that we have to work on. Again, it's one that, through, I believe, Doctors Nova Scotia and the college, we can make some progress on.
The honourable member for Pictou West.
Thank you, Mr. Speaker, and I thank the Minister for his answers. However, this fee represents a financial hardship for many, especially during these difficult economic times. These constituents are already at a disadvantage by not having a family doctor now, and now they cannot even retrieve their medical records without having to pay a large fee. My question to the minister is, some of these individuals have to now pay for transportation to even get to emergency in New Glasgow. So will the minister ensure that those that have paid out fees this week be reimbursed?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. We all know that doctors are part of keeping their records, having them go into storage. I believe it's a good area to examine, and especially when this does come along. But what I'm really pleased to say today to the House and to all Nova Scotians is that we've made great progress, and we will, during this year, we will see Nova Scotians finally have an answer to this question, because a personal electronic health record will be available to them.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, we have heard countless times from the Minister of Health that one of his main priorities is enhancing and expanding collaborative health care services in Nova Scotia. Luckily, Mr. Speaker, for the Minister, there's already a solid foundation laid for this work to move forward. They can continue on the work that has been done in the past, Mr. Speaker, even though they didn't think about it first or thought of it first. It just seems that the Minister is comfortable with starting from square one, Mr. Speaker. So I'd like to ask the Minister, can the Minister tell us how many new collaborative emergency centres have been opened under his leadership and this government?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Maybe if the member opposite would agree with me to remove the word emergency, we'd make a lot more progress with community care centres across Nova Scotia.
The Honourable House Leader for the New Democratic Party.
Well, Mr. Speaker, I won't, because the last time I checked, paramedics deliver and provide emergency care. So I don't know if he wants to change that profession or not. I won't agree with the minister. The Care Right Now report clearly tells us that these sites are working to address chronic, unplanned ER closures like the ones documented by my friend from Queens, Shelburne, Mr. Speaker, and have resulted in a significant drop in unplanned ER closures. All this, Mr. Speaker, the Minister himself has stated in the communities that have CECs, there was full confirmation on how well it's been working, Mr. Speaker. So I'd like to ask the Minister, could the Minister and the Government please just put their ego aside, accept the fact that CECs have improved the system and open more CECs across Nova Scotia?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I know that CECs have, in fact, been a wonderful solution for our GPs that were trying to manage their practice as well as cover emergency rooms. It is indeed a better way of providing health to communities. During the health services review, the current clinics and future CECs are part of that review, and I'm looking forward to a final determination on the communities that are on the list as to what will happen in those areas.
The Honourable Member for Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. And in addition to the question from the member from Pictou West, Mr. Speaker, I had couples in my Pictou Centre office here just this week that were upset over the amount of money that they have to pay to get their personal records. And my understanding is one couple said they had to pay $170 each to acquire them. Nevertheless, Mr. Speaker, we cannot deny that there's a shortage of doctors in this province. 4 calls were received through my Pictou Centre office yesterday from residents needing a doctor. These residents were also complaining about the long hours they have to wait for assistance as a result of not having a doctor. So, Mr. Speaker, keeping in mind that 4 calls were received yesterday, my question to the Minister, will the Minister finally admit that we have a shortage of doctors in rural Nova Scotia?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I know that Pictou is one of the areas that is being now addressed. I think he heard Dr. Lynn Harrigan say that we do have a number of hotspots across the province, and those are the areas that are currently getting the most attention. I know through the work of Dr. Bill Lowe, I see progress being made, and we hope to have a solution there in the relatively near future.
The Honourable Member for Pictou Centre.
Mr. Speaker, we have been experiencing an increase with residents visiting our office relating the problems that they're having renewing prescriptions, in particular narcotics, unable to find a doctor to sign the necessary papers. These people are suffering and need immediate assistance. We also have seniors waiting in a lineup for 1 to 3 hours before the clinic doors open. In fact, yesterday, Mr. Speaker, a couple in the lineup had to go back to their car and wait until someone saved a space for them at the door when the door opened. My question to the Minister, is it our expectation that seniors have to wait for a few hours in a lineup to see a doctor or to get the necessary documentation to purchase their drugs?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And this is one of the 4 or 5 areas now across the province that is receiving the most attention. We also know that considerable recruitment, has been carried out, and we'll see here in the very near future where some of those recruitments will actually start a practice, develop into a collaborative practice, and I'm looking forward to the Nova Scotia Health Authority, and in a very, very short time, we'll have a few wonderful announcements coming to those areas.
The Honourable Member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. Mr. Speaker, my question through you is to the Minister of Transportation and Infrastructure Renewal. Mr. Speaker, in the past, I've asked the Minister about the status of the twinning study and consultations. The study, which cost almost $900,000, was to be completed by the beginning of the month, and the Minister indicated that the financial modelling was still being worked on. And he also indicated that consultations were to begin around the middle of May. So my question to the Minister is, has the financial modelling been completed, and when will the consultations begin?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank the member for the question. We're still in draft form of the financial modelling piece. There's been a number of questions and clarifications happening and going back and forth between the senior members of our department staff and the consultants. Obviously, for us, with the nature and with the level of importance for this conversation for all Nova Scotians, we just want to make sure that the information is correct and accurate and easy to articulate to Nova Scotians so that everyone has an understanding of exactly what the decisions are and what we're going to do moving forward, and that we finally get a clear answer on where Nova Scotians are with respect to how we twin our highways moving forward. So we are still working at that, as I said to the member many times during question period and estimates. Once that information is compiled, then we'll look to do that public consultation. We're still committed to doing that as soon as we possibly can, and once we know that, we'll communicate it to the member. Thanks.
The Honourable Member for Sydney River Myra Lewisburg.
Well, I want to thank the Minister for his answer, and I would suggest there are some ministers over there could actually listen and see how an answer is given. Mr. Speaker, it is very important. Mr. Speaker, it's very important that all information from this study be on the table for Nova Scotians to see during the consultation process. It's also very important that the 12 sessions be meaningful consultations and that the wishes of Nova Scotia are certainly taken into account. So the question for the Minister is, would the Minister please outline the specific timeline established by his department to make a decision on the tolling after the conclusion of the consultation process?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. We haven't identified what we would do in terms of a timeline after the consultations and the community feedback is received. Certainly, we didn't, as we said many times, but it's not something that we want to let linger and just sort of dissipate. So we're going to move quickly on that. Again, with the nature of it, I think with the response we'll get from the public on both sides of the conversation, I think it'll be important to get that out quick. So as soon as we have all that compiled, I'm sure the member and members of his caucus and all Nova Scotians will have a role to play and have a vested interest, and we'll pull that all together and, of course, release it and have it to Nova Scotians as soon as we can. Thanks.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question this time is for the Minister of Agriculture. More and more people are concerned about GMOs, and earlier this year a foreign company signaled that it may begin selling genetically modified alfalfa seed in eastern Canada in April. Canadian farmers strongly oppose this introduction into Canada for many reasons, and the 2013 report called The Case for Preventing the Introduction of Roundup-Ready Alfalfa explains in detail why this is the case. The National Farmers Union has already written a letter to the Federal Minister of Agriculture raising their concerns about the issue, and many farmers are writing to me as well. So my question for the Minister is this. Can he confirm for us today whether or not genetically modified alfalfa seed is currently being sold in Nova Scotia?
The Honourable Minister of Agriculture.
Thank you very much. And as the member will know, this is a federal decision, not a provincial decision, to use genetically modified alfalfa in Canada. Unfortunately, we've expressed our concern about that to the federal minister. And at this point, I'm not sure if there's any for sale in Nova Scotia. We're investigating as we talk.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker, and I appreciate that response from the Minister. We've talked about this in the estimates, and I am very curious to know whether or not it's actually being sold yet here in Nova Scotia. Numerous people are now contacting my office concerned about this issue, claiming that the federal government has not assessed the economic impacts and has not consulted with Nova Scotia's farmers. In fact, a move in this direction could have serious implications for the future of farming in Nova Scotia, and several alfalfa markets are highly sensitive to GM contamination, and certain countries have banned their importation. So I'd like to ask the Minister, how is he working with his federal counterpart and Nova Scotia farmers to actually address this issue?
The Honourable Minister of Agriculture.
We've been working very closely with the Federation of Agriculture, as we do on every topic. We're very pleased to have their support as we move forward. We have brought this issue up with the federal minister, and we will continue those discussions.
The Honourable Member for Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Education. Mr. Speaker, the Minister's own review of regulated childcare said that insufficient spaces and limited options are a reality in some parts of Nova Scotia. My question, since there are insufficient spaces, when does the Minister plan to increase access to childcare?
The Honourable Minister of Education.
Thank you, Mr. Speaker, and thank you to the member for the question. The information that he shares is certainly consistent with the findings when we did our consultation, that we have to look at where we have spaces. In some areas of the province, we have more spaces than we need. In others, we don't have enough. So part of the challenge, but part of our responsibility as well, is to make sure that we look at those areas that are underrepresented and those areas that are not, to make sure that we provide that accessibility across all parts of this province.
The Honourable Member for Pictou Centre.
Mr. Speaker, just over a month ago, the Minister released the consultation findings and recommendations from the review of the regulated childcare sector. Among the recommendations was a call to increase the childcare options available to families and improving access to infant care and to children with special needs. A press release said the Minister accepted all recommendations. My question to the Minister, how many new childcare spaces will the Minister allow?
The Honourable Minister of Education.
Thank you, Mr. Speaker, and again to the member opposite. I cannot tell the member how many spaces there will be. I've indicated that when we sit down with the sector, we will be looking at those underrepresented areas where we need new ones. We will be looking at applications that are coming in from new operators who want to start up a daycare. We'll be looking at interest from existing operators as to whether they want to expand their operation. Those kinds of information and kind of decisions will be absolutely a priority for us, because we did say accessibility is an issue. Nova Scotians told us accessibility was an issue. It's our responsibility to respond to that.
Order, please. Time allotted for oral questions put by members to ministers has expired. We'll now move on to government business. The Honourable Government House Leader.
Speaker, would you please call public bills for third reading?
Now call public bills for third reading.
Would you please call Bill number 174, the Financial Measures Act?
Now call Bill number 174, the Financial Measures Act. The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. I'm glad to rise today on what will probably be our last day in this session, Mr. Speaker. And it's been an interesting process throughout the last, I don't know if it's been a couple months, but it's been a number of weeks, couple months. It seems like we're having so much fun here. I forget when we entered in April 14th, Mr. Speaker. But it's a time when Nova Scotians look at a government and look at what the path forward is, Mr. Speaker, in our province. And with the financial measures piece of legislation,